Hi, it's Dr. Elisha Van Dusen at New Hope Chiropractic. Numbness in the hand is a common problem that we've all had at one time or another. And unless it becomes frequent, we usually don't worry too much about it. It's not really a big concern. When it starts to wake you up at night, that should get your attention though. Since carpal tunnel syndrome, or CTS, is one of the most common causes of hand numbness, that must be it, right? Not necessarily, actually. CTS is caused by pinching of the median nerve as it travels through a sometimes too tight, bony tunnel made up of the 8 small carpal bones at the wrist. But there are 2 other nerves that arise in the neck and travel down the arm to the hand that may be the culprit, actually. One of which is the ulnar nerve, and the other is the radial nerve. When the ulnar nerve is entrapped near the humerus, which is your arm bone, it creates a condition called cubital tunnel syndrome, or CUTS. And that's during the examination that a doctor can usually determine if the culprit behind a patient's hand symptoms is the median nerve, the ulnar nerve, or even both nerves. That's typically what I look for when I do an exam in a patient with symptoms like this. Diagnosis can be tricky, as there are other causes of whole hand numbness, like diabetic neuropathy, for example, or an injury to a network of nerves closer to the neck called the brachial plexus. More commonly, cutting off the blood supply in the upper inner arm will make the whole arm, not just the hand, numb and feel like it's dead until it wakes up. And this can take a few minutes for the blood to percolate back into the arm and the hand. CUTS can occur from repeatedly applying pressure to the pinky side of the elbow, like leaning on the elbow against a hard surface. That's cubital tunnel syndrome. Resting the arm or elbow in the sill of a car door while driving, maintaining prolonged awkward positions, like playing a musical instrument, for example, like a flute or a violin. Baseball pitchers throwing too many sliders and curveballs are also an increased risk of developing CUTS. But like with carpal tunnel syndrome, the longer you wait before seeking treatment for cubital tunnel syndrome, the longer it can take to recover. And in some cases, if you let it go too long, full recovery is not even possible anymore. So if you're feeling numbness, tingling, or pain in one or both hands, please give us a call. Consult a chiropractor right away, and you can even book an appointment through our website at newhopechiropractic.com, and then we'll be happy to check you out and see what it is, and most importantly, get you some help. Have a great day.